So today we're talking about Adderall, one of the most used and most abused prescription medications out there. It's the kind of medication that can be a life changer for those who truly need it and create a mess for those who don't. Today though, we're going to go over what this medication is, why your doctor may be prescribing it, and what kind of side effects you need to be watching out for. Adderall is actually the name brand of a medication that contains amphetamine and dextroamphetamine. These two medications are what we call stimulants. Adderall is approved to treat attention deficit hyperactivity disorder and a sleep disorder called narcolepsy. This is where you can get sudden, overwhelming drowsiness as well as attacks of sleep. Adderall helps increase the availability of a chemical in the brain called dopamine. In ADHD, it's felt that there's a deficiency in this chemical. So medications such as Adderall help to increase the availability of dopamine in the brain, which aids, among other things, our ability to concentrate, stay awake, and gives us a feeling of well-being. Adderall comes in two different forms, an immediate release and an extended release pill. The immediate release can be given every 4 to 6 hours, and the extended release once a day. It'll last around 10 to 12 hours. Now these both are available as a generic medications in the United States and can be more affordable. Adderall is a Schedule II controlled substance in the United States, which means you need to have a hand-signed prescription for your doctor, or he has to send it through a special secure electronic form. It also means that you can't get refills and every prescription has to be a new one. It also means this is not a prescription that you should be taking or sharing without a prescription. Doing so can potentially land you into serious legal problems. Because you can't do refills and you need a written prescription, Adderall and the other stimulant medications can be kind of a pain to take. Because if your doctor is taking it serious, it means that you need to be seen every 1 to 3 months to get a new prescription. And for most doctors, if you run out early or lose or have your medication stolen, you're out of luck until it's time for a new refill. If you're taking it for ADHD symptoms, the main thing that we're looking for is an improved ability to focus, complete tasks, sit still, less impulsiveness, improved behavior, and overall improved ability to live your life daily free of your ADHD symptoms. If you're taking it for narcolepsy, we're looking for improvement in fatigue, alertness, and a decreased frequency of the episodes of falling asleep. In general, for those who are taking this medication at the prescribed doses, these are the things that we see, and the side effects tend to be quite minimal. For children on this, there are some specific things you need to know about because it is a stimulant, and if it has been given too late, the effects can last into bedtime to keep them from falling asleep. Another one that can be quite common is a decreased appetite. It is an appetite suppressant and probably the most common reason that in younger children we end up stopping it. Not only can it cut down their appetite, but over time, if that continues, it can actually cause some growth delays. This is why in children especially, they need to be monitored closely for any weight or growth issues. Beyond that, we can see some headaches, stomach aches, mood swings, and irritability, and rarely some tics. These side effects tend to be more related to the dose of the medication, so by working closely with your doctor, we can usually find a solution. In adults, some of the things that we watch for are an increased risk for high blood pressure. We can see erectile dysfunction, abdominal pain, constipation or diarrhea, and nausea. We also can see appetite loss, blurry vision, dry mouth, and an increased risk of seizures and tics. It can also cause some issues with making it difficult to urinate. Where most people tend to get into trouble with this medication when it is taken at excessive doses or not under the care of a physician. I hear quite frequently from patients how they tried a friend's Adderall and it seemed to help them. This always makes me cringe because you're really putting yourself at risk by taking or giving a controlled substance like this. If you think you have an issue that you may need this, go to your doctor and talk about it. Don't go taking medications on your own. Now, as I mentioned in the intro, abuse is a very common problem with Adderall. It's really popular in high school and college as a study aid. For many, they feel like it helps them stay up longer and focus better for studying and tests. Or others may take it as an appetite suppressant to help with weight loss. But beyond that, it has the ability to cause a high. Now the problem with using these medications not under the care of a doctor is that it significantly increases your risk of more severe side effects and addiction. The most common side effects of abuse are nervousness, restlessness, difficulty with sleep, shaking, headaches, changes in libido, stomach pain, nausea and vomiting, and loss of appetite. This medication also has a very high potential for overdose, which can be very dangerous. Symptoms of an overdose can be hyperactivity, hallucinations, agitation, rapid heart rate, rapid breathing, increased body temperature, dilated pupils, and loss of consciousness. It can also affect the rhythm of the heart, causing an irregular heartbeat, a heart attack, and even death. It really isn't something that is worth messing around with. Now, if that's not enough, When you're taking other medications, especially ones for your mental health like antidepressants, there can be some significant interactions that you're not aware of that can make you really sick as well. Well, that's a quick overview of Adderall. It can be a helpful medication for the right conditions and the right people. It isn't without risk though, so make sure you're taking it under the care of your doctor. Well, I really hope this has helped you understand Adderall a little bit better so you can make a better informed decision with your doctor. And that's our aim here at Family Med, to give you practical and evidence-based information so you can make a better decision about your health. And with that, we thank you for the time you spent with us today and hope to see you in the next video.